Hello, my name is Mindy Leatherberry, and this presentation serves as a community analysis of Winter Haven in the Sunshine State of Florida. In this presentation, I will include a historical overview of the community, a detailed community analysis which discusses the structure, population, health-related resources, environment, and government and public policy, as well as explore and prioritize community needs. The city of Winter Haven was founded in the mid-1800s by a single family of cattle owners named the Thornhills and rapidly grew to accommodate more and more settlers. As more families came, the village expanded, bringing farming and small stores. The village was unofficially named Harris Corners until the late 1800s when the name Winter Haven was given due to the favorable winter climate. The village continued to grow in numbers and resources and became incorporated in 1911, now a city. Citrus is the state fruit, and Winter Haven became the site for the headquarters of the Florida Citrus Growers Association. Migrant families began to flock here for work and to this day make up a large percentage of inhabitants. The beautiful city of Winter Haven is also lovingly known as the Chain of Lake City and is located in the center of the state. Its picturesque landscape boasts roughly 50 lakes spanning approximately 5,200 acres, 16 of which are connected by canals like a chain. From its meager beginnings of a handful of families, Winter Haven is now approximately 39.93 square miles with 33,874 citizens and is population dense with 878.38 citizens per square mile. The city is booming with a 15% increase in population over the last 10 years. Much of this increase is due to the seasonal influx of snowbirds who vacation in Winter Haven due to its warm winters. Winter Haven is the second most populated city in the county and is a vibrant and thriving community. The city of Winter Haven has large numbers of apartment complexes, subdivisions with single-family homes, RV and camper parks, one which boasts tiny houses, and low-income housing adequately meeting the needs of the diverse community. It is very rare to see any structures in need of repair, and streets are well paved and well lit with concrete sidewalks. There are 7 low-income apartment complexes sprinkled throughout the city which are well maintained and difficult to differentiate if the Section 8 logo was not noticed. Schools are numerous, ranging from elementary to high school, private, charter, and public. Polk State College is the local state college which recently added bachelor's degrees to their program list. Educational needs of the community are thoroughly met. Winter Haven has a large public library with countless resources and educational opportunities for all ages. Winter Haven has 2 large community centers which provides fitness and creative arts programs as well as a community pool. These facilities are free to use and frequently have community enrichment activities. The availability of these centers meets the needs of all social classes and provides safe places to engage the community and promote unity. Citrus Connection and Polk Area Transit are the community bus systems that offer inner city as well as outer city transit. Programs are available to the indigent population to ensure transportation is offered to all. There are approximately 50 churches within the community of all denominations and even some which offer multi-language services. Homeless resources are many, providing shelter, food, and clothing. The Talbot House, the Salvation Army, the Mission, and Meals on Wheels are all not-for-profit organizations dedicated to decreasing the disparities amongst this vulnerable population. The population of Winter Haven is as diverse as the landscape. The population is mainly Caucasian at 71.5%, with 23.2% Black African American and 4.9% Hispanic Latino. Being such a densely populated community, Winter Haven has a large percentage of vulnerable populations consisting of the economically disadvantaged, racial and ethnic minorities, the uninsured, low-income children, the elderly, and the homeless. 22.3% of citizens are age 65 or older, and 24.5% are younger than 19, both markedly higher than the state averages. The unemployment rate is lower than the national average of 4.1%, but still high at 3.1%. The percentage of citizens living below the poverty level is higher than the state average of 9% at 10.5%. Winter Haven has done an excellent job with recognizing these disparities and offering many services targeted to those living in vulnerability. The education level of Winter Haven rivals that of the state, with 32.3% being high school graduates and 43.5% having some college and higher. 60% of the community has chlamydia, gonorrhea, or syphilis, and 18% have HIV or AIDS. According to the CDC, these diseases are on the rise nationally in comparison from previous years. It comes as no surprise that the percentage of sexually transmitted diseases is high in Winter Haven due to its dense population, as the percentages of those infected would be proportionately higher than a lesser dense community. With such a large percentage of affected individuals, all forms of prevention are necessary to combating this problem. Winter Haven adequately provides services free of charge to infected persons at the health department, but the numbers reflect the need for a greater emphasis on prevention. Leading causes of death in the community are heart disease, cancer, COPD, and stroke. These findings are not inconsistent with national statistics and are common against the elderly population. According to the CDC, the two leading causes of death in ages 65 and older is heart disease and cancer. Prevention education should start early to decrease the risk of developing these diseases later in life. According to the Centers for Disease Control, 15 out of every 100 adults aged 18 and older smoke. Citizens can be seen smoking outside of businesses and while walking, driving, and sitting in parks, and 3 vape shops have opened in the past year. To combat this, Winter Haven has banned smoking inside and directly outside of businesses. There are many bars and pubs throughout the community which are heavily populated, as many are located along the lakes and boat docks. When speaking to police officers in the community, they report a large percentage of domestic disputes that are related to excessive alcohol consumption. Winter Haven is unofficially known as the meth capital of the world and is historically known for its methamphetamine problem. Emergency department nurses and EMS personnel report a high instance of drug-related overdoses. Citizens of the community are also statistically obese, being ranked one of the 7 most obese areas in the country. Winter Haven offers an eclectic variety of food sources, including supermarket chains like Walmart, Publix, and Aldi's, as well as a discount supermarket, Save-A-Lot. The city boasts numerous fast food chains and restaurants that can be found on every major road. Unfortunately, there are no places to obtain fresh, low-cost produce like farmers markets or outdoor flea markets, making healthy, sustainable food difficult for low-income families to obtain. Adequate pharmacies are available like Walmart, Publix, CVS, and Walgreens, and offer many free or low-cost drug programs. Winter Haven Hospital is the local hospital where many citizens seek primary care due to lack of insurance coverage. This hospital is equipped to meet the needs of the community it serves, as it has a nationally accredited stroke and heart center. Although not a trauma center, the nearest is only approximately 15 minutes away, 5 by air, in the neighboring city of Lakeland. The 2 main medical facilities, Bond and Gessler Clinic, offer a wide array of medical services and accept most major medical insurance plans, including Medicare and Medicaid. There are 7 urgent care facilities throughout the community, as well as numerous medical plazas offering services for all medical needs without needing to leave the city. With the high rate of unemployed and uninsured citizens, Winter Haven has many services available to help those in need. Central Florida Healthcare, the Haley Center, and the Polk County Health Department offer free to low-cost medical care, as well as referral services to ensure needs are adequately met. There are many barriers to seeking medical treatment, even when resources are available, such as the lack of knowledge of resources, feeling symptoms will get better over time, and time constraints. Education on the availability of resources is necessary to promote the health of a community. Winter Haven has many elderly services to meet the growing needs of the large 65 and older population, consisting of multiple ALFs, SNFs, rehab centers, and home health agencies. Medicare and Medicaid are the primary sources of funding for these facilities. The U.S. Department of Health and Human Services Healthy People 2020 develops a new goal set every decade to improve the health of the nation. The goals listed were selected for Winter Haven to meet the evident needs of the community. The goal of access to health care is to not just provide services, but to assist and encourage citizens to seek these services and develop a relationship with medical professionals to ensure follow-up care. As heart disease and stroke are 2 of the leading causes of death in the community, this goal was selected, which aims to improve health and quality of life through prevention, detection, and treatment of risk factors for these diseases. The third goal of sexually transmitted diseases is necessary due to the astronomically high percentage of prevalence in the community. The focus of this goal is to promote healthy sexual behaviors and increase access to quality services to prevent STDs and their complications. The environment in Winter Haven is conducive to year-round outdoor activities and has numerous parks with playground equipment for kids, nature trails, and areas for sports, adequately providing for the community. The many lakes are a great place to get out and get active, and having green space with places for activities promotes overall health of the community and is accessible to all. Legoland is a family-friendly theme and water park located on the edge of the city, which provides an excellent place where families can spend the day further promoting an active lifestyle. Air pollution is minimal, and as of January 2018, there has not been a recorded level above the acceptable range dictated by the government in over 30 years. The community is clean and well kept, and garbage, recycling, and yard debris is picked up once a week. Mosquitoes are a major environmental concern in the community due to the numerous large bodies of standing water. Polk County's Mosquito Control Unit regularly sprays to maintain the mosquito population below the allowable threshold to keep the risk of vector-borne diseases at bay. Winter Haven is one of the few remaining cities in the county which still have its own police department, consisting of 88 sworn officers and 29 civilians with a response time between 10 and 30 minutes. The police department has a large community presence and offers volunteer opportunities and youth programs. Winter Haven Fire and EMS departments have multiple locations, 3 fire stations, and 6 EMS stations throughout the city, making a quick response time of 5 to 10 minutes possible. These departments are very active in the community, coordinating events and educational experiences. Having a local police department and fire rescue meets the needs of the community by maintaining a hometown feel to promote a sense of safety and security despite its growing size. Citizens are encouraged to visit and can obtain information by visiting the city's easy-to-use and informative website. Another major environmental concern in this community are hurricanes and hurricane seasons spanning from June to November. Winter Haven has a comprehensive emergency management plan that is tested annually to ensure each contributing department's readiness. This plan is available to the public and gives the citizens a sense of security knowing the community leaders are prepared to deal with disasters should they arise. Winter Haven operates under the commissioner-manager form of government with citizen-elected city commissioners. The Board of Commissioners then appoints the city manager, city attorney, and city clerk. These officials must reside in the city and are elected for 4-year terms. The commissioners are easily accessible either by phone or email with the promise of a 24-hour response time. The Winter Haven Chamber of Commerce meets monthly and is open to the public to discuss matters and create critical topics and agendas to be brought to the bi-monthly commissioners' meetings. Members of the board are paying members and are highly influential citizens in the community whose goal is advocacy in regards to governmental affairs. Having an open and easily accessible government structure empowers the community and promotes a sense of support and loyalty. The city budget allocates a large portion of funds towards community resources for continuous improvement, allowing for the needs of the community to be adequately met. Listed are the prioritized needs of the community of Winter Haven. Although Winter Haven has numerous resources for all social classes, many citizens do not seek health care as they should or are receiving adequate follow-up. This phenomenon is the reason that access to health care is the primary priority for this community. A community nurse would need to focus on outreach programs to ensure those in need are aware of what's available to them. Health fairs and mobile health screening events are the most effective way to educate the masses. Preventative medicine is a strong second on the list. The citizens of Winter Haven are rapidly aging, with many older adults designing to settle and retire in the ever-growing community. The development of heart disease, cancer, and stroke stem from a long list of modifiable risk factors that a community nurse can tailor education around. Offering health seminars at places of employment, churches, and community centers would reach a large volume of people. Third on the list is healthy weight promotion. With Winter Haven being the 7th most obese area in the country, affecting children and adults alike, promoting a healthy lifestyle and appropriate food choices would be the target for community nurses. The many parks and recreational centers offers prime locations to host group fitness events and diet seminars. Communicable disease education and prevention is crucial for this community due to its high percentage of citizens with STDs and HIV or AIDS. The availability of resources to offer treatment in the community are numerous, so the focus of the community nurse would need to be on education and prevention. One cannot assume that the average person is aware of the contraction or spreading of these diseases, and education should start with school-age children by visiting schools and after-school care facilities. Fifth is substance abuse education due to the well-known methamphetamine problem in the community. Community nurses could develop outreach programs which target the vulnerable populations, as well as rally with the police department to create awareness programs in the schools. Smoking cessation made the list due to the high prevalence of smokers in the community. Recently, vape shops have opened, advertising a healthier alternative to smoking. Education on the detrimental effects of smoking and vaping alike and on cessation is crucial to stopping this national epidemic. Community nurses could advocate for funding toward smoking cessation programs. The order of this list is important as a cascade effect would occur. If citizens were more aware of and utilize the services available to them, each of the other needs could be accomplished in succession. These needs are also in line with the national initiatives of Healthy People 2020, providing an additional platform for support and funding. Winter Haven is a community rich in resources that are highly underused, as the statistics will support. This is unfortunate, as many communities do not have the same opportunities, and it is sad to think the citizens are suffering simply due to lack of knowledge. A community health nurse's main focus for this community would be to help the citizens tap into the wealth of resources available to them and utilize them consistently. This concludes my presentation on the community analysis of Winter Haven. I hope you have enjoyed the information presented on this beautiful city that I call home and will one day visit to see all that it has to offer. The sense of community and belonging here is unparalleled. You can find the references for all information contained within this presentation on the next slides. Thank you.